Greetings, Bio54. My name is Joseph Sepulveda, and welcome to my oral presentation on influenza. So what is influenza? Influenza is a contagious respiratory illness that is caused by the influenza virus. It is also called the flu for short, and is responsible for infecting the nose, throat, and lungs. In other words, the respiratory system. Many people confuse other illnesses, such as the common cold, with being the flu, as they carry similar symptoms. In fact, about 80% of all flu-like illnesses that occur every year during the flu season are not due to influenza at all. Signs and symptoms. Those afflicted with the flu may experience any combination of the following signs and symptoms: sore throat, headaches, fatigue, vomiting, muscle aches, cough, runny and stuffy nose, or diarrhea. Symptoms are likely to occur 1 to 4 days following initial exposure to the influenza virus. Any of the symptoms may range from mild to severe. Flu complications. In more severe cases of the flu, some people may develop complications. Complications are such instances where, as a result of becoming infected with the flu, severe health problems ensue. Generally, those who develop complications from the flu are categorized as high-risk groups. This includes those of very young or very old age, women who are pregnant, and people with pre-existing chronic medical conditions. Complications of the flu include sinus infection, inflammation of the heart, brain, and muscle, sepsis, pneumonia, asthma attacks, organ failure, infection of the ear, and sometimes even death. This is typically uncommon and normally only happens to those who are in the high-risk groups that I mentioned earlier. So how does it spread? The influenza virus spreads primarily by infected persons who cough, sneeze, or spit, thus releasing fine droplets containing the virus into the air and onto surfaces. As you can see in the picture below of the man sneezing, this is what it looks like when someone sneezes. And all that is going into the air we breathe. So it is considerate to cover your mouth and nose upon sneezing and coughing. Healthy individuals will then either inhale the fine droplets or touch an infected surface and then touch their face, spreading the influenza virus into their nose, mouth, and eyes. Infected individuals are considered contagious 1 day prior to visible symptoms and will remain contagious a full 5 to 7 days thereafter. Here's an example where an infected coworker decides to come into work and get everyone else sick. Some of you may have experienced this, where instead of taking a sick day, they decide to come into work anyways and expose everyone else to the influenza virus. Treatment and prevention. The best way to avoid getting the flu is to get vaccinated. Many people worry that vaccines carry harmful ingredients. However, the only harmful ingredient in a flu vaccine is a very minute amount of mercury, which is not enough to cause harm to healthy individuals. It is also possible to request a flu vaccine that does not contain mercury, if that is a concern for you. People who should not get the flu vaccine, or at least be cautious about receiving it, are women who are pregnant or nursing, children who are under 24 months of age, and seniors who are over 65 years of age, those who have allergies to eggs or mercury, anyone who has a history of Guillain-Barré syndrome, and immunosuppressed individuals. Vaccine strain influenza can actually be transmitted by persons, as the attenuated strain can be shed in body fluids for 7 or more days following vaccination. The second line of defense against influenza are antiviral drugs, which can greatly shorten time in sickness, lessen symptoms, and prevent flu complications. However, be aware that these antiviral drugs are obtained by doctor's prescription only. Avoid infected persons altogether if possible. Limiting your exposure is a good way to keep yourself from getting infected. Also, try to avoid touching your face, which can be difficult for many people because we tend to touch our faces a lot without even being aware of it. But the main pathways of infection are on your face, which are the mouth, the nose, and the eyes. Over-the-counter medication, such as acetaminophen and ibuprofen, can help alleviate symptoms. Bed rest and lots of fluids are also encouraged to make a quick and effective recovery. And last but not least, wash your hands. You might be surprised to know that it's actually quite common that people do not wash their hands, even after using the restroom. Pandemic flu history. There are a total of 4 flu pandemics that have occurred so far. During the Spanish flu pandemic, 20 to 40% of the worldwide population became ill, with approximately 50 million deaths worldwide. Of those deaths, about 675,000 occurred in the United States. There were about 69,800 that died in the United States from the Asian flu, and there was a second wave of that flu in 1958. There were a minimal of 33,800 deaths from the Hong Kong flu in the United States, making it the mildest flu pandemic in the 20th century. Then there was the swine flu pandemic, which many of you may remember, which affected 74 countries. There were between 8,870 and 18,300 deaths in the United States alone. Types of influenza viruses. There are 3 types of influenza virus: A, B, and C. Types A and B are responsible for causing seasonal epidemics, while type C can cause mild respiratory illness, but it is not believed to cause epidemics. Type A influenza. Type A influenza is divided into subtypes based on 2 proteins that exist upon the surface of the virus. These proteins are hemagglutinin and neuraminidase. There are 18 different hemagglutinin subtypes and 11 different neuraminidase subtypes. Type A influenza is also broken down further into strains. Type B influenza. Type B influenza is not divided into subtypes like type A is, but are broken down into lineages and strains. Currently, there are 2 lineages that exist, and they are Yamagata and Victoria. That concludes my oral presentation of influenza. I hope you all enjoyed it and learned something new.